Everyone, thanks so much for joining us today. We have a large number of folks who are going to be joining the platform all at once. So we're going to go ahead and give folks a little extra time to get logged in and settled. So we're going to get started at 3:05. So everyone knows you'll be muted upon entry. So if you have any questions or comments, please use the chat box. And at this time, you can go ahead and introduce yourself and let us know where you're joining us from. I'll be putting instructions on how to chat and how to connect to audio via phone if you would like to in the chat box. Feel free to let us know if you have any questions or need any technical assistance. Thanks so much. We're going to get started at 3:05. Hi, everyone. Thanks so much for joining us today. We have a lot of folks joining the platform at once, so we're going to give folks a little extra time, and we're going to go ahead and get started at 3:05. Everyone's been muted upon entry, so if you have any questions or comments or need any help with technology, please go ahead and let us know in the chat box. When you're chatting, please make sure to chat to all participants so that everyone can see your message. I'll also be posting instructions on how to connect to audio via phone if you'd like to do so. Please go ahead and continue to introduce yourselves and let us know where you're calling in from. Thanks so much again for joining us. We're going to get started in about 5 minutes. Hello, everyone. Thanks so much for joining us today. We have a lot of folks who are joining the platform at once, so we're going to give folks a little extra time to get logged in and settled. Everyone's been muted upon entry, so if you could go ahead and use the chat box to introduce yourselves, let us know where you're calling in from, and let us know as well if you have any tech issues or have any questions or comments. We're going to get started in 2 minutes to let folks have some extra time to join. Just make sure when you're chatting to go ahead and make sure you're chatting to all participants so everyone can see your message. And in the chat box, I'll be putting instructions to join audio via phone if you'd like to do so. So thanks so much again for joining us. We're going to get started in 2 minutes at 3:05. Thank you.
Welcome, everyone. This is Denise Solzbach. I am the director of the National Center at the Institute for Innovation and Implementation at the University of Maryland, Baltimore School of Social Work and deputy director of the TA Network. Thank you for joining today's Managing Now for a Better Tomorrow conversation. We are going to be tweeting throughout this discussion. If you would like to join us, please use the hashtags BetterTomorrow and TA Network Talks. And please tag us at Institute SSW and NCSMH stands for National Center for School Mental Health tweets. We do hope this conversation finds you safe and well today. We recognize this is a challenging time for all of us in children's services across the country, most especially for the families and youth that we serve. We have created these conversations for you to have peer-to-peer opportunities, for you to talk with the presenters as well as one another. As Sarah has mentioned, we encourage you to use the chat box, and we see you're very good at that, to share your thoughts and resources as well as questions for the presenters. When you use the chat box, please do select all participants. This will allow everyone to see what you are sharing. In follow-up to today's discussion, we will send everyone who registered a link to today's recording, as well as all of the resources and insights shared in the chat box. Today is very much a conversation. You will see presenters joining us from their homes, and we will not use PowerPoint during the discussion. And this truly is a series about managing now for a better tomorrow. Together, we are stronger in creating forward-looking solutions to meet the challenges of today while building a brighter tomorrow. If for any reason you have difficulty with your connections, please just log back on. If at any time you lose us, please stay with us. We'll bring you back. We have a troubleshooting team ready to assist. As I mentioned, this is a conversation and part of a series. We have held 8 conversations so far, including 2 on crisis communications, 1 on in-home behavioral health, 1 on supporting families, actually 2 on supporting families, because we have reached over 1,000 registrants for each of those. One on residential interventions, one on infant and early childhood mental health. And again, that one reached our capacity of 1,000 people. So we're offering a second on infant and early childhood coming up in next week, I believe. And we also had a conversation about mobile response and stabilization. Upcoming discussions that you're welcome to join us are housing instability and homelessness. We're going to hold that discussion at noon Eastern time on Friday. Next week, a second discussion in this series on school mental health will focus on supporting educators. That will be on April 30th at 3 p.m. Eastern. And as I mentioned, we have infant and early childhood mental health, our second discussion on April 29th at 3 p.m. Eastern time. And finally, we have rural mental health discussion scheduled for May 1st at 2 p.m. Eastern time. We are working on other conversations as part of this series, including supporting tribal communities. In order to sign up for conversations and resources during COVID-19, please go to our website, theinstitute.umaryland.edu/COVID-19. There you will see all of the recordings for our prior discussions, as well as registration links for upcoming conversations. And we will also be sure to post everything in our weekly TA Telegram. We'll be sure to post, if you're not already subscribing and receiving our weekly e-blast, we'll be sure to post how to subscribe in the chat box. As you know, today's conversation is on school mental health and supporting families and students during COVID-19. Today, we have a fantastic panel of presenters and subject matter experts to join in conversation with all of you. We have Dr. Sharon Hoover. She's the co-director of the National Center for School Mental Health at the University of Maryland School of Medicine, and she's also faculty at the Division of Child and Adolescent Psychiatry at the School of Medicine. She's joined by Dr. Brittany Griert. Brittany is a school psychologist in Colorado and was Colorado's School Psychologist of the Year this year. She also just gave birth to an infant, so she has an infant and a School Psychologist of the Year title all together there. She's also on the Government and Professional Relations Committee as part of the National Association of School Psychologists. Brittany and Sharon are joined by Jane Walker. Jane Walker is with the Family-Run Executive Director Leadership Association, FREDLA for short. She is currently a senior advisor and was formerly the executive director and founding executive director of FREDLA. Also joining us today is Liz Manley. Liz Manley is also with the Institute at the University of Maryland School of Social Work. Liz, many of you may know Liz. She is the technical assistance lead for several sites throughout the country as part of the TA network. She also leads our clinical and workforce best practices work within the TA network. And finally, we have Dr. Christopher Bellanci. Dr. Bellanci is with the Judge Baker Children's Center at Harvard Medical School, and he also serves as a medical director for the TA network. So with that, I'll welcome everyone, and I'm going to turn this over to Dr. Hoover.
Thank you so much, Denise. And I am really thrilled to see the participation level and to see so many already chatting in the chat box. As Denise already alluded to, we are going to be relying on all of you to really shape the conversation today. And I don't know about you, but I know that personally I've felt somewhat inundated by the amount of resources that are coming at me and the number of webinars even where they're guided by PowerPoints. And I found the most fruitful to be where we actually engage in conversations and learn from our peers. And that's what this is all about today. So I'm really excited to be facilitating. As it mentioned in the invitation, as Denise already said, our goal is to engage you in a conversation about school mental health. And today's topic really is about supporting students and families. And I can see from the chat, many of you are in that role. We also may have families with us today, and we're eager to hear from everybody about your experiences, but also about the strategies or innovations that you've seen in your own communities or in your states or tribes or territories, and some of what's actually working so that we can all participate in this kind of network or community of practice together. So as Denise mentioned, my name is Sharon Hoover and I co-direct the National Center for School Mental Health. So I'm just going to take 1 minute to share a little bit about the work that we do so you understand the lens through which I'm coming. And then I'm going to hand it over to Brittany for a moment. You heard a bit about her background as an excellent school psychologist. And we know school psychologists are a really integral part of our school mental health system right now, supporting our students and families. So our National Center for School Mental Health is at the University of Maryland School of Medicine, and we're actually funded out of the U.S. Department of Health and Human Services, specifically the Health Resources and Services Administration. And our role is to provide technical assistance and training and policy support to advance school mental health. And so we work with state leaders and district leaders and school leaders and providers to really support student mental health and increasingly educator mental health. We also serve as a community mental health provider in Maryland, in Prince George's County, and Baltimore City. And I served as a psychologist myself in city schools in Baltimore for a number of years. So that's the lens through which my frame comes today. And as with all of you, I imagine, the work that we've been doing shifted dramatically in the last several weeks. And as a national leader, we've been trying to respond to numerous requests from those in the field with respect to how do we respond to all students in terms of ensuring that we are adequately monitoring the mental health and well-being needs of our young people. And then also specifically around students who we already know might have some mental health concerns or challenges, and how do we ensure that we have a seamless continuity of supports to them, or at least some continuity of care, and how can we quickly transition to virtual support. And many of us, left the office one day not recognizing that we wouldn't be returning the next day. So this has been a tremendous challenge. And we're really eager to hear from all of you in terms of how you've coped with that challenge. We do have a website that I'll share in the chat box, and we have a page specifically devoted to COVID-19. And I know our partners at the National Association of School Psychologists that Brittany's engaged with also have a page that I'll go ahead and share. But I want to give the mic over to Brittany for a moment just to introduce herself, and then be prepared, everybody, because we're going to start asking you to be sharing your experiences and thoughts in the chat box as well. And again, so happy to see all of you introducing yourself. So keep the conversation going. Brittany.
Hi, everyone. Thanks for the introduction. And it's so exciting to see people from all over the country joining us today. So I'm really excited to see what everyone's been doing in districts and communities across the country right now. Just so you know my lens and how I can be offering perspective to this conversation. I was asked to join this conversation in my role on the Government and Professional Relations Committee as part of the National Association of School Psychologists, or NASP. They put out a lot of resources for how to support kids, families, and communities specific to COVID-19 pandemic. So I believe that's going to be linked for you all to use them as a resource. The work we do on the Government and Professional Relations Committee is very heavily involved with advocacy, working with our elected officials and partners across the country to advocate for the needs of kids. School psychologists, for those who may not be familiar with the work we do in schools, we are trained in providing mental health support, in working in the lens of special education, consulting with teachers, working with families. So we have a pretty robust training to really support at a time like this. So I'm excited to hear what school psychologists are doing around the country. I personally work in a school district, Aurora Public Schools in Colorado. We are a sanctuary city. So my school I work with is a preschool through 8th grade. We have a large refugee population, and many of the students I work with are English language learners. So that's been a learning curve for how we can think creatively to support some of our families that aren't familiar with technology, or also have a language barrier on top of the mental health needs we're seeing coming out. And then additionally, I am with the Colorado Society of School Psychologists as the legislative chair, advocating for the needs of students across the state of Colorado. So I kind of bring a advocacy lens from the school level up through the national level. And I'm really excited to be a part of this conversation.
Thank you so much, Brittany. And we know that school psychologists, as Brittany indicated, are absolutely critical to what's happening now, and also as we consider the return to school. And Amy in our chat box mentioned that she'd really like to see a discussion about supporting the transition back to school, which we intend to address today. So thank you for bringing that up. We also know that school psychologists are part of our broader student instructional support personnel, including our school counselors, our school social workers, school nurses, many others. And we also know that our educators, and in many respects our families, have become the de facto mental health system for our young people right now, both in terms of promoting mental health of our young people and also really trying to identify when there might be concerns and how to seek help. So we're hoping to touch on all of that today. And Christy asked, Brittany, would you happen to have any resources in Spanish that we could provide to families? So if you have those, we encourage you to share them. I have a number of resources in multiple languages that I will, when I have a moment, add to the chat box. So thanks for the question. And just a reminder, when chatting, go ahead and be sure that the to box or subject line says all participants, so we can ensure that everybody's questions and comments are seen and responded to. So I am going to go ahead and ask a question of everybody who's on, and we actually have hundreds of you on today, but we're encouraging all of you to share when you would like to in the chat box. So we first just wanted to ask about what the most prominent mental health concerns you're hearing about from families and students in your role at this point. And while you're putting those into the chat box, I wanted to actually point the question to Brittany as well, in your role as a school psychologist and what you're hearing across Colorado and nationally from your colleagues. What are the prominent mental health concerns that you're hearing about from families and students that you're working with?
Sure. I see Ellen looks like she said overwhelmed parents, and I think that's absolutely something very real right now, especially for our families that might have kids in high school and are getting tons of emails from all their different teachers. So really figuring out how to help with helping keep rigor for our students, but also supporting our families at this time. A lot of our kids, I've been talking with a lot of the kids on my caseload directly, and there's a lot of worry, not quite understanding why they have to be inside, a feeling of loss of I don't get to see my friends, I'm bored, my routine is different. So I think that those are some of the biggest challenges I've heard. I'd love to hear what other people are seeing they're having, but I would say anxiety, not only for kids, but for our families and our teachers as well.
Thanks, Brittany. And I see a lot of anxiety is coming up over and over and over in the chat box. Keep the responses coming. So anxiety, it sounds like, is one of the most prominent themes that we're hearing about. And also depression, concerns about losing loved ones. A number of you also said that one of the biggest concerns is families and parents specifically feeling overwhelmed, whether it's trying to contend with distance learning, but also we know the ramifications of COVID in terms of employment, trying to work from home if you still are employed and working from home while trying to support distance learning. So all of those sound like significant issues at home right now. Parents as teachers has come up a few times, and also some issues specific to students who may already have identified mental health challenges. We know that behavioral dysregulation might be heightened when routines are off, and so we're seeing that come up in terms of some of the responses as well. I do want to give a thank you to Lindsay, who already responded with some English and Spanish resources. So thank you for sharing those, and encourage everybody to keep looking at the chat box. I see Brittany also responded with some resources in multiple languages, so thank you for that. Jajanya mentioned a range of emotions bring confusion and stress for both parents and kids, and parents need targeted supports. So we are going to be asking you in a few moments, what are some of the best strategies that you've seen to support families specifically? One of the things that we've been asked a lot about is how schools are allocating their mental health supports right now. So I know on the line today, we have a number of school leaders as well as some district and even state level education leaders who are trying to navigate how they can best use their school mental health and student support staffing. So some examples that we've seen, for example, are school counselors or student support professionals being available at meal pickup. So if schools are offering meal pickup for families, they may be available there. Many student support professionals are holding office hours and communicating that out to families. We see some that are joining distance learning classes, so school counselors popping into math class or ELA or other classes during distance learning to do a social emotional learning content piece, or just to do a check-in to kind of let folks know that they're available and to provide them with their office hours. Those are some of the ways that we've seen, but I'm curious from all of you on the line today, how have you seen student support staff being allocated in terms of how they're using their time to support student mental health or even educator mental health? And while you're all responding, I'd love to hear from Brittany in terms of how you or your team has been allocated in terms of your time right now.
Sure. So in my district, all of our behavioral health team, which is comprised of school psychologists, school counselors, and school social workers, are available for our community to reach out to from 8 o'clock till 4 o'clock through Google Hangouts. That's the platform that our district is using for us to communicate with our families. We also can use the resource Talking Points, which provides translation texts that go to families. As a person who provides IEP support and service time to a caseload of approximately 30 minutes, the expectation is for me to develop a home program for each of the kids on my caseload, where I look at what their social emotional goal has been this year. And then I provide families with some steps they can take at home so that their child can continue to make growth towards that goal. So I've used some resources that I've found. I'm happy to put some links in for some things I've been sending home, but they can range from online videos for kids to sit through lessons. It could be ideas for coping strategies. I also do weekly check-ins with each of my kids. I've had actually all but 2 have set up weekly meetings with me, which I was really excited for that turnout. I wasn't expecting so many of the kids to want to check in. So I was thrilled to hear that. And I also connect with the families to see if they need support. Our district also, and my school, has set up virtual home visits. So our family liaisons and our paraprofessionals, as well as our front office staff, have divided all of the families in our school and are reaching out individually to make sure basic needs are being met. So making sure our families have access to food, if there are available resources for rent support, if there are behavior concerns, mental health concerns, asking, what do you guys need and how can we connect you to those resources? So that's been pretty effective and kind of a creative way to try to work with families to make sure those basic needs are being met. And then we're also doing crisis services remotely. I'd love to hear what other people are doing.
Yeah, and we'll definitely to crisis services. There are some amazing ideas in the chat box. I'll relay a few of them, and then we're going to speak to a couple of the questions that have come up. So some of the creative ideas include classroom guidance sessions, some of the things that you spoke to, Brittany, doing telehealth phone calls, checking in through the online platform. School social workers and psychologists in Denver public schools, according to Meredith, are providing some virtual open office hours, providing services under IDEA and 504 to students, and supporting student safety and resources. One of the questions that came in from Latoya Clark was, what is the school psychologist's role in the time of COVID, especially when families are in the middle of IEP planning before COVID? And we've received so many questions about that. what is the role of the school psychologist and the school team in terms of, and what is the responsibility really to continue 504, IEP, or other special education services. So I wonder if you could speak to that. It sounds like you're actively engaged in some of those services. What can families expect? What are the responsibilities?
That's a great question. And right now, I think that we're trying to all do the best we can and staying abreast of what the Department of Education is issuing in terms of guidance for how we need to provide IEP services. As of now, the expectation is that evaluations are to continue to the best of our abilities. State by state, I know a lot of psychologist organizations have put out guidance for what that means, as well as NASP has offered some resources about what does that mean. There have been some recommendations for any face-to-face evaluation to be put on hold when we cannot do them remotely. So for example, an IQ test might not be able to be administered right now because of the pandemic. Balancing our own expertise as providers, what is ethical and what the law is telling us in terms of how we're working with families, how can we interpret data about our kids when we're all experiencing a trauma right now. So there isn't a clear answer for all of those factors, but the expectation is that kids continue to have a free and appropriate public education, similar to their peers, and that special education services have not been put on hold. And we're continually monitoring what the Department of Education is putting out. So please keep checking with your state departments of ed, what your district is recommending, what your state associations are doing in terms of guidance, because I think that that's a huge conversation nationally right now.
Great, thanks, Brittany. And I've seen a number of you, Katina, Amanda, others, indicating that you have a system for doing wellness checks. We've had a lot of questions about how to do that. So if anybody has a moment to share in a little bit more detail how you're doing wellness checks, because we know that there may already be systems in place and relationships with those students who are receiving services through school prior to COVID, but some are trying to build systems to do wellness checks with all students. So if anybody has a great system for doing that or some ideas about how people can get started with that, we'd love to see it. Jenny Combs asked the question, what platforms is everyone using for virtual support? So please, if you have ideas about platforms, we've already seen a number of them come up. We saw Google Hangouts, we saw FaceTime, we saw Zoom, Google Duo. We know there are pros and cons of different platforms, but we also know that federal guidelines have really loosened the parameters for what's allowable with respect to both HIPAA and FERPA privacy guidelines. And so we're grateful for that, but it certainly does not come without some challenges and a learning curve. If anybody has any other, well, it looks like folks are chatting right now about some that they're using, including Zoom Healthcare and DoxyMe. So thank you so much. And in Chicago, you're using Zoom. That's great. Excellent. And Microsoft Teams from Keeley. Thank you so much. So one of the questions from Kira is there a central location where information about how different states are releasing guidance on special education can be found? And I see Brittany nodding her head. I can go ahead and put a couple of links in, but go ahead, Brittany, take it away.
I was more nodding because I was just on a conversation with some different school psych leaders in different states in the West, and that was a need that came out. Was we'd love to just be able to go to one place and see what all the state association guidelines will be. So I was more nodding because I was like, yeah, great question, but I don't have a great link. So if someone else on the one of the other presenters does, please add that, because I did report that back to NASP, so hopefully we'll be able to put that available for people now.
That's great. We do know that if you look to, and we'll put it in the chat box, into the U.S. Department of Education COVID pages, they do have a number of the federal guidelines that are clearly articulated with respect to how to support students with disabilities, for example, under IDEA 504 and so forth. So that's located right on the U.S. Department of Education site, but state specific and specific for school psychologists or different professional organizations, you might have to turn to their national organizations for that inquiry. So it sounds like that's a need that lots of people have, and so we would love if any of you have a direct link to it, but if not, we encourage you to reach out to your state professional associations. So one of the questions I wanted to also throw out there is, with the idea that I mentioned earlier, in many respects, families have become the de facto educators, but also mental health supports for their children. And so the role of many school mental health professionals and community mental health professionals has moved in some respects to being coaches or supports for families. We know that many parents of children with mental health concerns, for example, have expressed distress at trying to meet the demands of distance learning while navigating their children's mental health issues. So I'd love to hear from all of you in terms of some effective strategies that you've seen for engaging and supporting families. We know that there are some guidelines or suggested activities out there for families for how to schedule your day, how to support your child, regulate their emotions. Any of your best resources or ideas, we would love to see you share in the chat box. And while you're sharing that, I'm going to ask Jane Walker from FREDLA if you have any ideas about how you have seen families best be supported, or ideas for how you think they may best be supported, or just what you think some of their specific needs might be right now. We'd love to hear from you.
Sorry, I was on mute. Thank you, Sharon, and thank you everybody for being on this most important conversation. The organization I'm with is a family organization. That is, it was started by families who have children with mental health needs. We have membership of 20 similar state and local organizations across the country. And in the last few weeks, we've had our own conversations with those family leaders across the country. And the messages we're getting back, I saw the very first response, asked the question, Sharon, what are you hearing from, was overwhelmed. And I would say that is overwhelming to families from every aspect. They've talked about their housing situations and such closed quarters, their inability to even purchase necessities. Some talked about even like formula for their infants or diapers. We heard and what we anticipate is going to be growing financial needs and the impact and a heightened stress with so many people on lost their jobs.
Jane, I'm going to pause you for just a moment because it appears that your audio is cutting in and out. I'm so sorry to say. So we'll try to have somebody work with you on the audio because we want to hear everything that you have to say. I know a couple of the themes we absolutely heard, which were that families are overwhelmed, whether it's about some of the very basic needs, food, housing, losing their economic sources, right, and so forth. And then how to support their children and families. So we'll try to get your audio working. We see some other ideas in the chat box about how we can support families, some with their own ideas from their own families. It sounds like magic money has been huge for me. I've seen virtual Zumba and yoga for the whole family. So we have seen some really creative ways of supporting children's and families' wellness and well-being. and also recognition, Katina is saying parents are seeing those social emotional issues that the school system has been seeing and now are requesting help. So we certainly have heard that as well. Many are saying that they're encouraging breaks and activity and mixing things up. Mai said, I've been able to create a spirit theme week where youth are able to have a theme for each day and throughout the week. And those are some of the ways that I think our school mental health professionals, as Maya is saying, have been able to support families directly by trying to provide some structure, perhaps not so much structure that it's adding to the overwhelmed feeling of families, but a bit of structure weaved in with some fun, and encouraging families to develop routines is being brought up a number of times. Michelle shared a resource for us from the MHTTC network, which is the Mental Health Technology Transfer Center network, and it's titled Fostering Resilience, Responding to the Needs of School-Age Children. So thank you so much, Michelle, for sharing that with us. I'll share a few more resources as well. And a few other resources have come up in the chat box related to providing telehealth, for example, and some other resources in multiple languages, which is fantastic. So thank you so much for those resources. I'm going to identify a couple of other questions that came up. So Bill Brown is asking if assessments have been put on hold in the case of an initial IEP, does this stop the identification process? And if yes, could this be considered to be a denial of FAPE or free and appropriate public education? And Brittany, I'm going to ask if you can speak to that. We don't expect you to be the expert on all of the federal law regarding special education, but if you have ideas or if others have ideas in response to Bill's question about the IEP process and the identification process and what that means in relation to FAPE, that would be really helpful.
Sure. I think a really important piece to consider is how important the role of the family is in that process, and making sure that when we are considering holding an evaluation, that families are really brought into that conversation and that they are signing permission for that. I think that ultimately we all love and care about our kids and want to do right by them. So teaming with each other, having really open conversations about why we think we should or should not move forward is important. And again, consult with what your local district, if you're in a local control state, with your state guidelines, with the national guidelines, because things might look different district to district, state to state.
Thank you so much, Brittany. So one of the questions that has been asked is, how do we help our educators and our school system identify young people who may be experiencing not only mental health concerns, but possibly child abuse or neglect? We know nationally there's been a downward trend in reporting of child abuse and neglect. And one of the hypotheses about why that's happening is because our educators are often on the front lines and able to see some of those red flags immediately. And with distance learning, not only are their lives disrupted, but they're having less frequent contacts with young people. And they're also not able to see visibly some of the signs that they may have been looking for. So I'm curious for all of you on the line, if you have any resources or tips to share regarding really equipping our educators with the tools to support identification of mental health concerns, child abuse, family violence. I see Katina mentioned a notable increase in domestic abuse as well. And thank you, Michelle, for sharing the New York Times article about child abuse and recommended actions. And Dakota's mentioning about 20% of reports are typically made by school staff. And so part of that downward trend, not surprisingly, may be related to that. So we'd love to hear from all of you about either resources or strategies you've put in place to help equip your education community, your educators, your teachers with the tools that they might need. And I'd love also, Christopher, if you don't mind chiming in, just to share some ideas about how our educators, for example, can be kind of maybe more aware of what they might want to look for in terms of mental health concerns through this distance learning technology.
Sure, I'd be happy to. Thank you. And I just am so in awe of ideas and response to each other in the chat, so keep that happening. Dakota's right, about 20% nationally of child abuse reports come from educators. And so with schools closed, there's less of that in-person contact where you might become suspicious that abuse is happening. And somebody else commented upon concerns about increases in domestic violence as well that are going unreported. And interestingly enough, calls to suicide hotlines are actually down during this period. But the crisis text line has seen a 49-fold increase in texts from young people. So I think particularly young people are reaching out through the technology that's most familiar to them. And the crisis text line is a great resource in that regard. And one of the things I noted in their data analysis, and they do some really great metrics in analyzing the data coming in through their text line, almost half of them are from LGBTQ identified young people. So clearly that population is particularly feeling a crisis, perhaps with less access to gender and sexuality alliances that are school-based. We've embedded so many supports and services in our schools, which is terrific, from public health access to behavioral health access, to social emotional learning supports, to community-based services, to meals and food, that in the absence of schools being open throughout the country, we're having to then scramble to figure out how we're going to replace all of those essential services that were provided through schools. And others have raised the question of the disparities that this illness is causing, both in terms of the numbers of people of color who are at greater impact, it appears, in terms of who's dying from COVID-19, and then also the disparities around accessing all of the services that so many people are creatively discussing that often require having a computer, perhaps having multiple computers if you've got multiple young people in the house. You've got parents who are also trying to telecommute, fighting over the landline, if there is still a landline, et cetera. And then trying to create the space where all of these conversations can happen simultaneously, which is not easy either. I've heard about creative solutions where some people are taking turns using the bathtub or the bathroom or finding private space in the basement. One of the things that has come up as an approach in outreach to young people is asking them who else is in their physical space, both in terms of trying to get a sense of privacy, but also trying to get a sense as to whether or not they're having to screen what kind of information they're sharing with you. And coming up with like a keyword or a safe word should somebody enter the space who they're not comfortable having overhear what they're communicating with their counselor. Making sure that the young people using headphones, which so many young people do have, so that at least the part of the conversation that the school counselor may be having with them isn't overheard by any of the parents or anybody else in the area. And I'm sure that other folks have all sorts of other strategies that they're reporting, but I think continuing to have a level of concern, a level of inquiry, and being alert, because one of the opportunities here is that we're being invited into people's homes in ways that we hadn't previously. And that can reveal a whole host of things that can be troubling in terms of what you may hear in the background, and then being able to find ways that you can follow up with the young person. I wish the safe word was my awesome idea. It actually was something I learned from another chat conversation, and this is the beauty of this. To quote Jadania, do your pandemic best, which I love, and being creative in an unprecedented time. And so I don't think, I think there needs to be a lot of forgiveness and a lot of permission to try things out. Things that may be something that we might have been hesitant to before, but if it's in the best interest of the student, maybe it's something that you would consider doing. And I think there's great ideas being suggested.
Thank you so much, Christopher. And, you know, Karen reminded us a few chats ago up here that we have to remember to ask parents how they're doing as well. So we absolutely want to ensure that we are checking in with our students and creating ways that they can safely report if they are feeling unsafe or if things are happening to them that they need to report to somebody. At the same time, with us being in families' homes and knowing that they're overwhelmed perhaps and have extra layers of stress right now, it's really important to ask parents how they're doing. And as Karen said, this is a simple, kind gesture that has meant so much to adults. A release and feeling of support from us is really important, she reminds us. I also want to go back and revisit some of the amazingly creative ideas that have come out just about in the chat box about supporting the general mental health and well-being of our students, all the way from virtual barbecue gatherings that Carla mentioned to Stacy mentioned that her teenage daughter, who's a senior in high school, had a couple of spatially distanced campouts with 3 to 4 close friends where they could sleep in the back of an SUV and on properties and safely distance and bring their own food and drink. And so we do want to keep in mind those opportunities for promoting all students' connectedness. We know that connectedness is a really important protective factor, especially for our students with pre-existing mental health concerns, but really for all of us in terms of what's happening right now. And thanks to those of you who shared some news clips, but also some resources with respect to child abuse monitoring and reporting. So a news clip from Oklahoma, thanks for sharing that, Mike. And Carla shared some resources from the Mayo Clinic. And Lauren reminded us that Mental Health America releases a toolkit every year in May, and there's some wonderful resources there. A few folks mentioned to Robin that they would love to see the crisis protocol document that you created for staff to use during COVID-19. So if you're able to share that with this team, we're happy to send it out. And Denise shared with us a reporting tip sheet from Alaska during in the context of COVID-19. So really appreciate this ongoing list of resources that we're generating here. It's incredibly helpful. And some of you have mentioned that schools, in essence, have become the wraparound service for our communities right now. So a few other questions that have come up in the chat box. Lindsay Adams asked, how are other schools supporting students that may have had a suicide risk assessment before school closures? So this really speaks to this broader topic of suicide risk and how are we not only attending to suicide prevention and what are some of the considerations there, but also direct intervention in the context of virtual support of families. And we've also had a lot of inquiries around suicide postvention. So for example, when a student does suicide in a school community, how can a school in this virtual disconnected environment really support students and families in conducting memorials, for example. So we'd love to hear everyone's ideas around how to address issues related to suicide and crisis response. We're seeing some already come up in the chat box, which is great. I do know that some of our colleagues at the Suicide Prevention Resource Center have put out a couple of trainings on how to do suicide assessment. So there's some online training on their site, suicide assessment in the context of COVID or via telehealth. And I'll put a few of those resources into the chat box. But any other ideas from our panelists about not only identifying suicidality, but also the protocols for responding in the context of telehealth? Brittany or Christopher?
I also just wanted to respond to the question. I think a lot of people like the idea of a safe word or some black dot or some other way of the young person being able to communicate that they're in some kind of distress, but they're not able to talk about it at that moment. I think the response of how do you educate them about those options depends on which platform you're using. So if they have headphones on, then and you can presume that the conversation is private, you can talk to them and describe what would be most appropriate. There are some technologies, for instance, Zoom has this function where you can actually write into it, and you can even have, even particularly for younger kids, you can actually do a shared drawing option. And I don't know about like Doxing Me, I'm not as familiar with that, if that has some kind of a similar option or if it has this kind of chat option. You can also convey in some way, if you're open to receiving text from your students, you can offer to have that be conveyed via text, or just do boilerplate, you know, and say, with all of my students, I'm just reminding them if there's anything that they want to talk to me privately about, this is the way to share that information. So that there is some conveying of a method that would allow a young person who doesn't feel safe. As well as just kind of say, I'm reminding all of my students, just like I've been talking with all of my staff about the employee assistance program. You can remind them that there's a crisis text line, or there's a 1-800 number for if you're feeling particularly stressed or feeling suicidal, or any of the things that, based on your relationship with that student, might be something that you're concerned about.
Thanks so much, Christopher. And a number of you have mentioned that you're really continuing some of the same suicide assessment, safety planning, and reentry processes that you had in place before schools were out related to COVID, but that you're doing these virtually. I've put a number of resources in the chat box that speak to some of the interventions that schools are doing with respect to suicide. One that I want to bring your attention to was from the Trevor Project, speaking specifically to implications of COVID-19 for LGBTQ youth mental health and suicide prevention, and they have some excellent resources in that document. And Stacy Skulski from NAS mentioned that they're posting some skill-based Ask the Expert webinars, and the next two will address suicide prevention and intervention protocols and behavioral threat assessment, and that those will be linked to guidance that NASP has posted on these topics. So that's incredibly timely. Thank you for that resource, Stacy. And we see a number of other resources here as well. So thank you so much for that. I want to ask, as I turn to a few other questions from our audience, I just want to take a moment to ask Liz, if you could just speak to one of the things that has come up, both in the context of what do we do if we have a student who's suicidal, who may need hospitalization, for example, but also in terms of our students who have more intense mental health concerns. Many families are really not wanting their child to go to a hospital or to go into residential care right now with health concerns. And so, given your extensive experience in the context of community crisis, I wonder what wisdom you have to share in terms of what we can do to support kids and families in terms of what community supports might be available to them and how they can navigate the decisions they might have to make regarding community care, hospitalization, residential care.
Yeah, great question. So a couple of things to think about. First of all, we don't want children in emergency departments or inpatient hospitals. Now, I say that most of the time of the year anyway, right? So that's really the work that I've been doing for years. And what we have learned is that you can really provide a ton of support and surround children and youth who are experiencing suicidal ideation and even have planning. If you can surround them with people who care about them and really address some of the underlying needs, they're best served in their own homes anyway, right? The idea of going into an emergency department or into an inpatient unit actually raises the risk level around suicidal ideation and makes that youth at higher risk to begin with. And so this work really forces us to say, we need as many people and partners in this work as we can get. And so reminders that mobile teams still exist. They're still working. They're still doing a ton of work, although a lot of those mobile teams have reported that they've had decreased calls as well, because of the same reasons child welfare calls are decreasing. But those teams are also reporting that when they go, that there's a higher risk when they go, that people are waiting a longer period of time. So reminding parents and caregivers and the youth themselves that there is assistance that's available. And that assistance really should come early, right? We want to get there as early as possible. And that assistance may come via telehealth, but there are still teams that are responding when necessary to the home if that's what's necessary in order to keep children safe. Now, a lot of those teams are now coming with PPE, right? So they're coming with masks and they're coming, protected. That protection is for families as well as it is for the worker themselves, but that's just a reminder of all that. So the community supports that are still in place tend to still be in place.
Great, thank you so much, Liz. And I see that Beth Ann shared a resource also from NASP on preparing for school suicide intervention in a time of distance learning, a prevention checklist. So thank you so much for sharing that. Debbie asked a question, or rather really an ask for resources. If anybody has any school crisis protocols that you can share, they would love to see them. So you certainly can share it with our team's organizers and we'll put that out. Or if you have any that are linkable that you can put in the chat box, that would be great. We've had a couple of questions about how schools and school mental health systems are using technology to hold meetings, whether it's meetings of school counselors and school mental health teams or family group sessions. For example, Jadanya just asked about what about family group sessions and are we able to hold those via distance technology? Have any of you on the line today had experience with continuing group team meetings? I know many of us are doing a lot of video conferencing. Have your protocols changed? So any experiences you can share in the chat about holding group meetings with your school mental health teams, but also very curious to hear about, are any of you using these technologies, telemental health technologies, to continue group counseling or family sessions, family support sessions even? Please let us know if you are. And Brittany, I'm going to ask you if you've had continued school mental health team or student support staff meetings with your team, but also are you or any of your colleagues continuing group kind of supports via these technologies?
Sure. So yes, I have been involved in a lot of staff meetings with my mental health team, which at my school is our 2 school counselors, myself, and our school-based therapist. So we use Google Meet to do those meetings. We've been holding IEP meetings virtually, and we have utilized interpreters for some of those meetings, which is kind of an added layer where we'll have the interpreter join the video chat and then we'll call in the parent, or we can have everyone video chatting. It's been helpful to use video platforms that we can all share a screen for note taking, going through the IDEA checklists for eligibility for IEPs. In terms of running groups, I know that's been a question asked in our district, and there have been concerns about confidentiality of being able, we are broadcasting into other people's homes. So if you're holding a group, are you identifying other students with IEPs by holding a virtual group session? So that is a consideration to think about how we can protect confidentiality when a group could be taking place in someone else's home. So that's been a challenge. I've done mostly individual check-ins. There's a couple of families that I see a couple of their siblings, so I've been able to do some sibling groups. And then our counselors, I know, kind of offer open groups where anybody can come to participate. So kind of thinking creatively about how can we still offer that resource while not breaking confidentiality for our kids. And then I know for signing, we've been using DocuSign to sign some of the legal documents that we need. But there have been challenges. I think a lot about equity. A lot of our community, some of our families that are from are refugees, they've never really utilized computers. A lot of our parents don't have an email address. So we've really not been able to take a one size fits all, or this is kind of the standard protocol. It's really been a what do for each individual case and individual family, and just operating with a lot of grace and knowing that we're all trying our best at this time and making sure that everyone has access.
Great. Thank you so much for that. And just in looking at the chat, and what we've heard nationally as a center is that there seems to be quite a bit of variability in terms of guidance around conducting group sessions. For example, it seems that everybody's saying, yes, our school mental health support teams are continuing to meet via phone or distance, video technology, but some are continuing to do groups. It sounds like Catherine Burns, for example, says we're doing online therapy and groups and meetings. And so maybe that includes groups as well. It sounds like it does, whereas others have indicated that they're not allowed to do groups other than universal classes. We've also seen, so we support a number of groups who are doing trauma interventions across the nation. And one of the things that some of the clinicians have chosen to do is take out some of the trauma narrative components, for example, but they're doing skill building groups instead that could be a bit more didactic. So they've changed the content a bit, reducing some of the privacy considerations, but also they felt that that was more amenable to the group process and the virtual environment. So and Jess just really acknowledged, Brittany, what you were saying as well around refugee families and the unique needs possibly in terms of at least Jess saying here struggling with understanding some of the guidelines. Jess also mentioned switching to one-on-one to do interventions and then posting activities to everybody. So that's really helpful. One of the questions that has come in from Andrew is, do any of you have suggestions for referring to first episode psychosis programs? So I'll touch on it quickly and then I'm going to pass it over to Christopher. So I know, for example, in our state, as in many states, they have quite active first episode psychosis programs where you can actually refer or call in and self-refer, or a family can refer a young person they may be concerned about who may be experiencing a first episode psychosis, and they can undergo an assessment. In Maryland, we have continued that process, and most of it has been virtual or over the phone or video at first, and then if warranted, there'll be in-person services provided. Christopher, I'm going to hand the question to you to see if you have anything to add there.
Yeah, and I put in some resources in the chat. So there are a couple of national early psychosis networks. One is based at Stanford, so that's PepNet, and the other is at in Oregon called the ESA community, and that stands for Early Assessment. Help me out, Liz. Hold on a sec. And Support Alliance. And the idea behind a lot of these is that they're modeled on a wraparound approach that is specific to young people presenting with psychosis. And what they're finding is with that specific approach, they're able to reduce the number of medications the young person has to take. They're finding they're able to keep them out of the hospital for longer periods of time. They've got greater compliance in their own treatment. There's a strong peer-to-peer kind of a model. So all the best of the wraparound approach, as well as some really great family supports, because we're often talking about young people who are in transition age. And as these young people turn 18, 19, 20, they have the ability and will often exercise the option of sharing their mental health information with their parents, often who are still caring for them actively, which puts the parents in a very challenging situation. And so there's a lot of work in family outreach to support those young people. So Massachusetts also has its own state version of these networks, and it's a great way to then find out what the resources are in your specific community.
Great, thank you so much, Christopher. and continuing to see a number of resources come in, which is fantastic. A couple of people have mentioned that Robin, you are our hero. Robin has shared several ways that their system has put in place processes for continuing supports, and one that she noted here is having a very detailed consent that lays out for parents the risks and probably also the benefits of telehealth services. And they go over this at length with parents and require written consent for all students engaging in telehealth. If anybody has examples of telehealth consent forms, I know there are some floating around right now on the web. If any of you have some that have been successful that you'd like to share, we'd love to see that. And we saw also Krista up top mention that they have specific consents for group telehealth. So that is certainly one way of addressing that. We know that there are cautions and legitimate concerns, but we can certainly also work with families to share some of the benefits and some of the concerns about doing group telehealth. So one of the things that we know is that schools are a place where mental health promotion occurs every day, and many schools have in place, positive behavior supports or social emotional skills. And so we wanted to take a few moments at least to talk about how schools are supporting the mental health of all students. One of the questions we've been asked a lot is how can educators check in daily or regularly, perhaps not daily, about student social emotional well-being? They may be the only person outside of the family who's interacting regularly with students. I'm going to share a couple of examples in the chat box. One of a more sophisticated kind of online way that it's free, but educators get a dashboard of the daily emotional well-being of their students, and one that's very simple, but lots of teachers are using it. It's a copyable Google form, essentially, that they send out to their students at the beginning of a distance learning session, and it asks about 4 questions. It's kind of a multiple choice. How would you describe your mood today and why? And then it lists out, would you like to be contacted by any of the following? And it includes all different teachers, but also school counselor, principal. And so a lot of teachers are using this as a way of gauging kind of what's happening with students, but also as a way of getting support to students who need it. So I see already our wonderful partners here putting some information into the chat box about how you're doing this. But any other ideas? Brittany, I don't know if you're doing anything specifically to check in with students or encouraging educators to check in with students.
So I know we have a PBIS, Positive Behavior Intervention Support Team, that's still meeting to think about how we can support students. But really the approach our district is taking is holding open office hours and having teachers refer to us directly. I'm seeing a lot of great ideas in the chat about the Google form check-ins. So I think that's a great way to do that. But I think waiting for the kids to call. I think one of the barriers, and I'd love to hear if anyone has an idea around this, has been providing callback numbers. I've heard some people using Google Voice. I know that there's been some issues about compliance in different districts allowing or not allowing that, but that's been a barrier, as if, how to get a hold of us when people need us. And the technology literacy, it looks very different for various families. So I'd love to hear if there's other people that have ideas about how they're having people get a hold of them for referrals.
Great, thanks for bringing up some of those questions and concerns. And if people do have ideas, please share. Looks like Robin mentioned that they're implementing a Google form for school mental health and services, and that they do, or Krista mentioned they do an attendance each day with a Google form, but that part of that is having a mental health check embedded, which is, again, a really creative idea. Katina mentioned they've been giving families restorative circle ideas. And Ren, just in response to your inquiry, Brittany, mentioned that they use Google Voice and send text messages and provide contact information that way. And Jess mentioned having a check-in in the Google Classroom and Seesaw for kids regularly. So some great ideas here. Some use regular office numbers, and then it might forward, so their IT systems have forwarded. So we're going to continue to check some of the questions, but another topic we wanted to get input on was ideas for social emotional learning. We've already heard from some of you that you're either supporting social emotional learning in your schools, or you've certainly observed others doing that. I'll share a few resources that we know about in terms of some of the opportunities for social emotional programming, some of the social emotional learning programs that are out there offering their programs for free at this point. We have really creative examples from school psychologists and school social workers and counselors who've created YouTube channels and are doing daily videos to their students on all sorts of mental health topics. So I'll share some of those. But any other ideas or resources that people have used to foster social emotional learning content for all students during this time, we would love to hear about. And while people are sharing that, Brittany, I don't know if you want to share any specific social emotional learning strategies. I've just put some in the chat box here.
Sure. So in addition to sharing some of those that I'm seeing come up, like Second Step has some great online lessons. You know, one of the struggles for me as a provider is we have 130 languages spoken in our district. So providing links to lessons recorded in English isn't always able to work with all of my families. So one of the things I've been doing is taking pieces that's common in a lot of lessons, like a problem thermometer, and being able to modify that with Google Translate to whatever language I need, and really explaining to families some really concrete tools to use has been a good strategy. And I've been able to check in weekly then to say, you know, let's talk with mom and kiddo. What's one problem that you had? What was your size of your problem? What was the size of your reaction? And that's been helpful. And also modifying to what families can handle right now. In talking to families, there are some that are like, yes, send me all the resources. I want lessons you can give me, strategies to use. And some families I've checked in on, they're like, you know, the capacity I'm at right now, if you could just call and talk to them for a few minutes once a week, that's what we can handle. So really trying to meet families and kids where they are with what they can do at home realistically, and modifying things as we can.
Great. I'm so glad to see also, in addition to some of those strategies, Brittany, a number of you have mentioned how you really are leveraging your school resource officers as part of your student support team. And Krista mentioned a couple of ways that you're doing that. And I know that Amanda mentioned that many students and families have a positive relationship with their SROs, and so they can stop by either in the community or virtually through some of the distance learning activities, and that can be really useful. Herson Guerrero has asked specifically about students with ADHD and 504 and IEP plans while at home. So we know that many students who are struggling with dysregulation or inattention or difficulties with executive functioning are really struggling right now, and their families might also be really struggling to get them to engage effectively with learning content. So Herson is asking for any suggestions for parents at home who are struggling with their kids during distance learning. So I'd love to hear from folks on the line, any ideas you have or resources. But also, Jane, I'm not sure if your audio is working. If you have any thoughts, or Christopher or Brittany, whoever wants to share specific thoughts about supporting students with ADHD and their families at home during this time.
Sharon, this is Jane. I hope you can hear me now. Can you?
I sure can. You sound great.
Oh, good. Child Mind Institute has a great resource specifically around helping students with ADHD while at home during this COVID pandemic. And they talk about learning spurts, being able to just, you know, help children set aside certain amount of time that they are able to deal with, and then interspersing that with activities. So the Child Mind Institute, we can put that link on as well, has a great resource on that particular topic.
Great, thank you so much. Christopher, Brittany, any specific ideas around supporting students with ADHD? Brittany, it looks like maybe you, oh no, Christopher's unmuted, I think. Go ahead, Christopher.
Yeah, I mean, I think it depends a little bit on how severe the restrictions are on being able to be outside. And so, you know, young people with ADHD, they just need to burn up some of that energy. And so figuring out a way, if it's doable for them to take some academic breaks, if they are doing online learning, to come back, or if family that has some kind of a bicycle or something that they can set up, or even if they've got a bicycle, get some training wheels and kind of lift the back of the wheel up, or kind of be creative in figuring out how they can burn up some of that energy. There's been some really nice studies where young people were able to take a break, get on an exercise cycle, even if it's for 10 or 15 minutes, go back to class, and their ability to then access learning and be more available to learning was exponentially improved as a result of that activity break. So if they're already on an IEP because of their ADHD and there were some OT strategies that were built in, I would be thinking about how to adapt those OT strategies in a creative way to the home environment and try to embed that into the day. Kids with ADHD really strive and benefit from structure. And so trying to keep to some kind of routine, to the predictability, try to keep the school day as much of a school day, try to keep the weekends as breaks, try to keep to what the life of your family and schedule would look like as much as possible. That can be really challenging. I'm not diminishing how difficult that can be given the demands on adults to telecommute from home and all the competing priorities that we've talked about for technology, et cetera. But I think particularly for the population of kids with ADHD, you've got to figure out some way that they can take some break. Somebody was even talking much earlier in the chat about the restrictions on public spaces. A lot of parks are closed to discourage people congregating. And so they were talking about people doing walks in cemeteries, which I thought was really interesting. And why not? You can even do a search for the most interesting gravestone, or who has the oldest gravestone, or some kind of activity break like that. You know, there's no standard script for how we're going to be able to adapt our approach during this pandemic. And so coming up with some thoughtful ideas, try things on for size and see what works. And then the things that work, repeat them. And if not, come up with some other ones.
Thank you for all those good ideas, Christopher. Brittany, were there any additional things that you wanted to share?
I put it in the chat box, but I've had some success, especially talking to families, and the parents are like, oh, I'm really bored, or wow, this is just hard. Or even for me, there's a ton of free apps right now. There's so many free workout classes, and some are kid friendly. So recommending that families can download some of those free resources to do together. So like Down Dog has 7-minute workouts for a little break. I know Nike has some free ones. So some of my kids have really liked doing those. So that's been kind of a fun, different way. And collaborating with my PE teacher has been awesome. She's made this like a dance challenge where kids upload YouTube videos of them doing a different dance, and then she compiles it into a video and doing different contests and things like that. So just collaborating with the other people on my team, especially for things like breaks or movement breaks, has been helpful.
Great, thanks so much, Brittany, and I appreciate the resources that folks are sharing here. I love the suggestion of going outside with your students or families virtually, if that's possible, in a session. And someone mentioned, yes, today is Earth Day, so what better day rather to do that? And I think one other point I want to make here is just the validation and giving grace to families around the idea that students are not likely going to be at their best for learning right now, and that's not a reflection of poor parenting or something that the parent is doing wrong. Someone in the chat box acknowledged earlier that often moms are bearing more significant burden, and there's good research to show that in this time period. And so there's a lot of guilt and even shaming that comes with that. And So I think part of our role as school mental health providers, whether it's in coaching our educators or just reaching out to families, is to support families with the acknowledgement that it's okay if your children aren't as motivated. That's normal. That's typical right now. The decrease in structure many people are experiencing. So there can be a lot of, again, guilt or shame in not having everything perfect. So we can play a role in normalizing and validating some of that. So I do want to move, as you know, we have a few minutes left, and I want to make sure that we attend to the topic of returning to school. And I know for many of us, I'm a parent of 3 teenagers myself, and it seems like a long way off, and it's still incredibly uncertain in many ways. But some of us are starting to think about how can we best support families and students and school leaders and educators as we return to school. So I'm very curious to hear from all of you about if you're doing anything now to prepare students and families for the return to school, not necessarily directly, but are you building things in place? Are you generating ideas with your team about the return to school? Next week, and I'll mention more on this, but we're going to talk more specifically about supporting educators. But are there things that you're thinking about now in terms of how to best re-engage families and students for the coming year? I heard on a recent discussion that I was participating in, someone saying that we need to expect that the capacity for being able to engage in learning is going to be decreased at the outset of the school year, and that we need to attend to that. And we also know that that's exacerbated by our health and education disparities. So I'd appreciate any ideas that you all have. We know that there are certain mental health concerns that we anticipate needing to better attend to related to anticipated increases like grief and loss and trauma exposure. And so it's certainly a call for our mental health workforce in terms of getting professional development resources. So any resources or ideas you have, Alyssa mentioned, would love to get some bereavement information. I know Ellen here said that they're working on bereavement training for mental health providers and staff. And Michelle mentioned that the conversation next week is on supporting educators with a link there. Robin mentioned that they're talking at this point, very concerned about the return, and likely we'll see an increase in the need for mental health supports and abuse disclosures. So a lot of ideas are kind of circulating right now about this topic. It looks like Michelle mentioned that they're going to be engaging in the Nas Prepare Model. If you're not familiar with that, I don't know, Brittany, if you can speak to that. I know it's a crisis response program that NASP has. Can you speak to that just for a moment?
Sure. So Prepare is a 2-day training that helps school-based mental health providers be able to effectively respond to trauma that's occurred. So how do you work with kids? How do you work with staff? So I believe NASP has information on their site that's been linked here about how to obtain the training. A lot of times states will offer trainings. I'm not sure if it can be done remotely. That's a great question to ask. I believe they're 2-day in-person trainings. And then I'd also just like to put a plug in for how important advocacy is right now, especially, we're seeing schools are not just places where kids read and write and do math. We're really a huge part of helping with mental health, helping with food resources, many things for our families, and how important it will be in the coming months to really use your voice from a local level in your local communities all the way up to a national level, calling your elected officials to really advocate for how important funding is for schools and having mental health providers, and saying we don't want these positions cut. I think we can expect that there's going to be an increased need to support our kids and families and staff when we all come back together in whatever shape that will look. So just making sure we're fighting for how important this is and how much our kids need this. Schools are our biggest mental health providers in the country. And I'd really hate to see our ability to provide for kids in an increased needed time go down.
I love that, Brittany. Totally agree. I couldn't agree more that in many ways, even with schools being shut down, I think there's been an increased awareness of just how central schools are as a hub for families and children to get supports, including mental health supports. And it really is the conduit for so many families for social emotional support at this time, but beyond this time. And I do want to also draw attention. Jess put some great ideas about not only acknowledging the inequities in terms of the accessibility of outdoor space and activities of students living in lower resource communities, but she also offered a solution. So Jess mentioned that they're sending home craft kits and popsicle sticks to families in lower income areas because they may not have those resources. So we'd love to hear about creative solutions to really support families living in all different situations, because we know, as you mentioned, Brittany, earlier, there's not a one size fits all. And so a couple of you also acknowledged that this may really shift both the education systems and the healthcare systems in the future in terms of thinking about online learning and treatment. And to Brittany's point, that's probably a large part of our advocacy right now, to really recognize the value in some of those and also the essential role of schools. So I do want to take a moment to ask if any of our panelists want to share just 30-second closing remarks. I'll ask Jane, Liz, or Christopher. Any of you have any closing remarks that you want to make?
I'd love to just say a thank you to everybody on here for the work you're doing. As family members, you know what this is like, even with your own families. And I think educators, school mental health providers have adapted so quickly under these stressful times. And I know that healthcare workers are getting a lot of attention, applause, appreciation, which is very well deserved. But I think we would put educators and school mental health providers in that same category. So just a very heartfelt thank you to everybody.
Thank you, Jane. Liz?
Yeah, I agree with Jane, and I'd also say, listen, remember your partners. Your partners are the community mental health folks who are still up and running and still willing to help, and to be great partners in terms of bridging some of this work in helping organize for youth and families and be support for youth and families as well. Thank you.
Thank you. Christopher?
I think in crisis there is opportunity, and as we're trying to manage today for a better tomorrow, I think it's going to be really important for us to start gathering data, and I think school folks are actually really good at collecting data on response to interventions. So there may be things that we learn from this adapted approach that we may actually want to continue after the pandemic, and the best way to show that would be to gather data. So I really encourage folks in the midst of doing all the other things you're doing to begin to think about, even if it's anecdotal, even if it's qualitative, begin to capture some of those stories, because there may be things that we want to continue post-pandemic.
Thank you. Brittany, you already had some great closing remarks around advocacy. Anything you want to add in the final seconds?
I'll just add a thank you to the work everyone's doing from every aspect in the community right now, from parents that are supporting their kids at home while managing their own things going on, to the kids, to the school providers, to our community providers, to our trainers. Just everyone's really stepping up in a major way, and just thanks for all the resources and ideas.
Thank you so much to all of you. And I want to close by saying a big thank you as well, and to remind us of our role, not only in addressing some of the anxieties and the fears that are here, but also really in instilling optimism and hope. and trying to bolster readiness as we do enter the new school year, whenever that may be. I want to thank everyone for active participation in the discussion, and we'll be sending the resources shared in the chat to all of those who registered and a recording of today's discussion. Your contributions, as you all saw, really do demonstrate that we're creating forward-looking solutions together, as Denise shared at our outset. I want to thank you again, and finally, just want to encourage you to all take time to take care of yourselves as you're working to care for your communities and your families. Thank you so much, everyone.